These doctors are working around the clock to provide top standard medical care in Nigeria. Heart diseases are one of the leading causes of death in the country. So the Evercare Group, who have a 165-bed purpose-built hospital in Lagos, launched a catheterization lab in November 2021.
So a cath lab is an operation theatre for intervention procedures. So when somebody is in need of coronary angiography, angioplasty, a pacemaker, or even an interventional radiology procedure, peripheral stenting, so this is the place that you come to.
Evercare's mission is to transform healthcare in Nigeria. In the past, people have had to travel abroad, even for procedures that can be done in Nigeria, and so we aim to change that.
Cath labs are an important part of diagnosing and treating heart conditions. The Evercare Cath Lab is said to be one of just 7 in Lagos State, helping to bridge the healthcare infrastructure gap. And the hospital offers more than just interventional cardiology.
We don't just have just one modality. We have the interventional, we have the clinical cardiology, then we have the open heart surgical aspects. And so this is very, very important to me as a cardiologist, where your patients don't just stop at some particular point. They get to go all the way with us.
Most of our patients come from the cardiologists. So the cardiologists, they treat heart diseases with medications, but the surgeons treat heart disease with surgery. So there are some patients, when they investigate a patient, like in cath lab, when you do coronary angio, a patient that has chest pain, okay, and they go and check and they see that, some of the vessels are blocked. There are some of these vessels that they cannot do by interventional procedure. So such cases come to us.
Beyond the cath lab, this hospital is equipped with a team of cardiothoracic surgeons, carrying out some of the most complex procedures in the world. Open heart surgeries are very expensive, costing patients tens of thousands of dollars abroad. So Evercare is determined to ensure that patients can have these surgeries at home with less financial strain.
So we are at the moment standing in theatre. As you recall, we had operated a case yesterday. We did a case, a young guy, 59-year-old, who underwent elective coronary artery bypass grafting. We put the patient on a heart and lung bypass machine so that we can safely stop the heart and able to do the bypass surgery. Now, yesterday's case was we were able to actually extubate the patient on table, and I'm glad to inform you that he has done very well overnight, and he's continued to recover well today in ICU.
One patient at a time, the Evercare Group hopes to transform Nigeria's healthcare industry through affordable and uncompromised medical care. So the cath lab is an important development.
Lack of awareness that we have centers like this. Now this is one of the first and the only private hospital that has so many specialities, multi-specialities under one roof. So we have to create awareness that yes, we are able to offer things that you go out for, and we are offering them at competitive prices, and we are offering them with competitive expertise, so to say.
What I would hope for Evercare is that we will continue to grow, we'll continue to maintain quality as we do now, and we will become the preferred destination of choice for Lagos, for Nigeria, for West Africa, even Africa and beyond.
Ambition is key. In due time, the group intends on introducing even more complex procedures, like organ transplants.
So Evercare as a whole would like to pursue that organ transplantation. I understand that they are aiming to achieve this kidney transplant by end of this year. And certainly we don't want to be behind. So from cardiac perspective, we would like to do the same thing. So heart transplant, and that's something we are looking at.
There is no doubt that these are much needed developments within Nigeria's healthcare industry. Laila Johnson-Salami, Arise News, Lagos.